Welcome back to First Coast Living. Now, only you know your body, so when things aren't functioning normally, you should probably see a doctor, which is why we got one in the house right now, Dr. Robert Zayden with us, and you are a medical oncologist at Baptist MD Anderson. So there's a lot of there's a lot of information about colon cancer out there, but there's other types of digestive cancers.
Yes.
So can you tell us about that? What are some of the risk factors and warning signs you might see?
Heidi, thank you for having me here. Colon cancer is actually the third most common cancer in the U.S., but pancreatic cancer, which is actually a more deadly form of cancer, is also increasing. Some of the warning signs are unintentional weight loss, abdominal pain, and in later stages, patients can have yellowing of the skin and eyes, also known as jaundice. Esophageal cancer is also increasing, and risk factors include prolonged indigestion, alcohol and tobacco abuse, and patients will usually complain of having progressive difficulty eating, initially difficulty swallowing solid foods, and then later on as the disease progresses to difficulty with liquids. Fortunately, in the U.S., stomach cancer is not as common as it is in other parts of the world, such as Asia and South America.
Yeah.
But patients that have been exposed to a lot of processed foods, eat a lot of foods high in nitrites or nitrates, people that are smokers, people that have a certain bacteria called Helicobacter pylori, are at higher risk. And symptoms again include abdominal pain, unintentional weight loss, nausea, and vomiting. And
you mentioned a whole different, or a bunch of groups of cancers. Can you tell us what's unique specifically about this group of cancers?
So digestive system cancers, unlike breast cancers or skin cancers where patients can see a mass growing or see a spot on their skin, typically don't have any specific symptoms until they're more advanced. So for example, with some of the digestive cancers, patients will present at a later stage. The American Cancer Society has estimated that about 289,000 new digestive system cancers will be diagnosed in the U.S.
Wow.
As a matter of fact, the digestive system accounts for more cancer diagnoses and more cancer deaths than any other organ system in the body.
Wow. Those are staggering numbers.
That is a big deal.
Okay, so can you tell us a little bit about, you mentioned this a little bit, like a prolonged indigestion. Is that a sign of stomach cancer? Can that lead to stomach cancer?
So one of the symptoms of stomach cancer is indigestion, but that does not necessarily mean that that's what it is. As a matter of fact, and most of the time, indigestion is not stomach cancer. It is.
Well, that's a relief, because I can tell you, I pop Tums all the time, so that's a relief.
However, having said that, indigestion that is new and worsening, especially over a few weeks to a few months, should really be checked out by your doctor, especially if it's associated with unintentional weight loss and nausea and vomiting.
And can you touch a little bit on just the steps you can take to prevent that? I mean, are there steps you can take to prevent this? Because you're talking about digestive system, you got to eat.
Yeah, right. So speaking of food, that's one of the things we can do. We know that a healthy diet rich in raw vegetables, leafy greens, a diet that's low in red meat, a diet that is high in antioxidants and vitamin C is protective against a lot of these digestive system cancers. Eating less burnt smoked meats, I know that's sacrilege in Jacksonville, but less barbecued meats.
I'm from Texas, so you're just blasphemy.
Foods that are lower in nitrates and nitrites are felt to be better for you. Also, speaking of eating, obesity. The obesity epidemic is linked to cancer. So we know that maintaining a healthy BMI is good. Get your colonoscopy on time. A polyp takes between 7 to 12 years to go from just a polyp to a cancer. So finding it early and getting rid of it can prevent colon cancer later on. Also, speaking of Helicobacter pylori, that's a bacteria that a lot of us have in our stomach. If you have that, get that treated. And it's important, though, that having Helicobacter pylori or H. pylori does not mean you will get stomach cancer.
Well, that's a relief. Yeah. That's good to know. Real quick, can you tell us, can sugar cause cancer? Because there's a lot of information out there about, sugar causing cancer.
Sugar does not cause cancer. Sugar is the common currency your body uses. Every single cell in your body uses sugar for metabolism.
Yeah.
So increasing your amount of sugar does not make cancer cells grow faster. Unfortunately, cutting back on sugar does not make cancer cells slow down.
So it's kind of a moot point, neither here nor there.
Right. Now, having said that, we know that a diet that is excessively high in sugar can lead to diabetes and obesity, and both of those are conditions that have been linked to cancer.
So that's what creates the breeding ground for it. Well, this was a lot of great information. Thank you so much for being here, Doctor.
You're welcome. You're welcome.
And we would like to thank Baptist MD Anderson for sponsoring this segment. For more information, you can visit baptistmdanderson.com or simply give them a call at 1-844-632-2278. You can also find them on Facebook on their page, Baptist MD Anderson.